Hi, I'm Baravarian, and I'm going to show you my preferred technique for the Lapidus procedure. I'm also going to try to go through and give you some of the pearls associated. So the first is just the markings. So I do my lateral release through a fairly small mini incision. I don't always open up the medial aspect of the joint. A lot of times if you can release this and realign the joint properly, you don't necessarily need to open up medial. So I do that last. When you want to feel where the joint is, if you slide your finger along, you'll feel a little ridge. And also, the other way to feel it is to just move it up and down and find your spot. And then you want to kind of make an incision that is maybe about 3 centimeters or so you can get your staple in. So first for lateral release, make an incision and just kind of dissect down into that area. And I normally will just take a Sen retractor and kind of pull that lateral side apart. And then I just kind of find where my joint is. I'll slide in the side of the joint and do my lateral release intracapsular, and then I'll slide along the edge and I'll release my collateral ligament. Just along the edge, releasing the collateral. Once that's released, you can come out, you'll find that your toe will then relax. And it really shouldn't be like a huge amount of work in here. Your incision needs to be maybe about 0.5 centimeter there. Once you do your release, then you can get back into your joint here. And just for sake of saving time, I'm going to dissect all the way down to the joint. But you would basically go layer by layer, kind of opening that joint up. So layer by layer, you would go down and dissect out your joint and make sure that you find what you need to see. I try to tend to make my incision a little more distal than proximal because you are going to put a screw in, and proximally you don't need very much. So mainly it's more distal than proximal. As you come along, the joint is kind of fairly easy to find in here. You can see in this area, this is my joint, and I have my kind of alignment done. So you can see I'm not very far back on here because I don't need a ton of space to be able to get that in. Okay, so that's about the amount of size you need. You could do a little less on this side if you're just doing staples, but if you're going to put a screw in, you need a little bit more room. Go ahead and hold that for me. So I'm going to use 3 wires to get things realigned. So you can basically realign things in different ways. What I normally like to do is I grab my toe, I kind of like to push in and push down and rotate that straight. So this wire is going to aim for the medial cuneiform, and then into the navicular is what we say. It looks like I'm going to go way out. It looks like I'm going to go way out medially, but this wire is actually aiming for the navicular tuberosity, and you're going to be dead center on the cuneiform. Take another wire from you. So once you have that first wire, our second wire is going to be a medial wire here. And this wire you want to aim a little bit distal to proximal and a little bit lower. And this wire is going to go into your intermediate cuneiform. So your angle's there. I'm hitting bone there. Going through, you would check this under fluoro, of course, to make sure you're in the right area. Okay, one more wire. And then the third wire is really just, if I feel I need additional fixation, kind of running it down at this angle and leaving it there. This wire is really not that important if these 2 wires are solid. The most important thing with staples is to have really good 3-dimensional stability temporarily, because when you go to knock in a staple, you can plantar flex the metatarsal or rotate the metatarsal. And I think that's why one pin holding the metatarsal cuneiform joint 1 and 1 pin holding metatarsal cuneiform 2 allows for 3-dimensional stability. And once you have that, then knocking in the staple is not going to be a major issue. Next, we're going to take our guide for the staple. So on the staple, you'll see that there's measurements here. So this is 15, 20, 25, just to show you depth you need. And you're going to center yourself over that metatarsal, and you're going to make your first drill hole. So positioning wise, I tend to like to be kind of dorsal and a little bit medial. I think it just sits better there. You can see that there's measurements on here, and it kind of shows you where you need to go. And then you can kind of just adjust this and see whether you're in the right place. And once you're done, you're going to take your 20mm staple. So the way that this loads, it's pretty ingenious. You basically put it in, and as you lock this piece, you can see the staple gets wider. And when you release it, the staple compresses in. So if you look at that angle of the staple, and then you look at it here, you can see how it gets wider. And that's where you're getting your compression factor in. And this is relatively easy. Line it up. Once you have it lined up, I prefer to just gently mallet and get it down. Once you have it down, release and get this off. And then you're going to use your tamp here to finish it off. And that's pretty much as easy as the first staple is going to be. Once you have your first staple in, you really are not going to have a lot of rotation issues. So if you have a wire that's in the way that is bothering you, it's kind of in the way of your hand, this first staple is so strong that you really are not going to have to worry that much about additional wire fixation. But for the time being, we're going to leave it the way it is. I'm going to show you how to put in the second staple. And just for sake of visualization, I think I'm going to turn the foot a little this way. Your anterior tibial tendon is going to be kind of down in this area here, and you want to be a little careful. You can see little fibers of the anterior tibial tendon coming in there. So I'll take a drill for the 15. So this again, center of the joint. You want to be low here because you get better compression on the lower end. And I highly recommend using your temporary pins. Temporary pins are important. We'll take our staple. And again, you can see that when you lock it, it spreads. Find your hole. And release it. And then we're going to use a tamp just to get it tamped down. And you can see, just to show you how flush that sits. So the flushness of this is going to help with the anterior tibial tendon. Sometimes I'll come back in here again and just try to kind of tamp this down a bit more if you need. These are definitely lower profile than a plate. So it's almost impossible for this to be higher than a plate. But what I prefer when I look at this is trying to get this thing to sit more like this, right? You can see this thing is flush against the bone, buried in the ends. And this staple gets a lot of its structure from this end structure here, right? And so one of the things to be careful about is sometimes the ends will be a little bit higher than the middle. And if you find that the ends are a little higher than the middle, number one is you can take a tamp and just kind of go to the end and just kind of knock it down a bit. Or if you have, like, let's say that you have your metatarsal cuneiform joint and there's a ridge or a ridge like this and it's not completely smooth, don't be afraid to nip this away and nip this away. Get yourself a smooth surface for that landing for the staple. It doesn't mean you have to do the entire top of the bone or anything like that. You want to leave that cortex nice and structured, but you know, the width of the staple, you just kind of take a nipper and just rongeur out that center portion, and that'll seat the implant down just a little more. And normally it's at the ends. It's not that much in the middle. Kind of want those ends to seat a little bit more. Once you have this, we really kind of could be done. So you don't have to on every single case be like, oh, I need to put a screw in. These two staples structurally are incredibly strong. And I really don't look and say, oh, we need to put more in order for this to be stronger. But I think that what I like to do is an intercuneiform test. So under fluoro, I will stress this and see how much motion there is. If I see that intercuneiform joint opening up, if I see my metatarsophalangeal joint opening up, and my metatarsal isn't 100% tight, I'll put a screw in, and I usually go first met, second cuneiform, but you can also do first met, second met. Both of those will work and do the same thing. So let's take a drill for the 4/0 screw. You first measure on this guide, and it's fairly simple. So this is measuring about a 42. Normally these screws run around 36 to about 44. This is a 42. Once you know what size you are, you tell your guys to get it for you, and then you want to kind of take this down to where you are getting rid of this head. So you're burying the entire driver portion. And by burying this driver portion, you basically are making the spot for your screw to bury. I would suggest that you do this under fluoro, of course. And as you go along, feel for your cortexes so that you can kind of tell where you are. So as far as this is concerned, you'll kind of be able to tell as I go. So this is cortex 1, cortex 2. That's medial cuneiform cortex I'm going into, and I'm at about 30. And that's going through to that cuneiform. And that I can feel is the end of my cuneiform there, okay? So if your wire comes out, don't worry about it. It's common and it's not a problem because you've already got your fixation and this is gonna go straight back in. Next, we will tap. I have different opinions on tapping. I think that tapping is good if there's hard bone. I think these screws, we've kind of like gone back and forth on whether you need tapping or not. I will tend to tap harder bone. And on the 4/0 screw in the metatarsal cuneiform joint, I tap. The reason is that you're going through multiple cortices. But I haven't been tapping every single one of my screws. Some of the 3/5 screws that I'm doing for an osteotomy bunionectomy, I don't tap anymore. And if you're in softer bone, I don't think you really need to worry about heavy duty tapping. You can just break through the medial cortex and just make sure that the screw's gonna go, and then you should be okay with going. So again, we'll put our pin back in. We'll grab our screw and our screwdriver. I normally will squeeze and rotate again, so I will push this metatarsal over and down as I go in order to put this screw in. And the only thing that's also weird is once you've tapped, the screw feels like it's almost like, wait a minute, why is it going so easy? It's because you've tapped. If you didn't tap, you'll actually like feel it. This screw needs to be a little bit distal to the prong here. And really you want to be low. So if you think of the metatarsal cuneiform joint, most of your opening is on the bottom. That's why the 15 by 15 screw, the staple should be on the lower side, and your screw should be almost low to high, not high to low. That's how you're going to get more stability. Just to show you what this should look like once we're done, you have your staple up here, you have your staple on the side, and then you have your headless screw here that goes across. If you ever find that your headless screw is slightly angled, it's a little high, you can burr it down a tiny bit. I wouldn't burr down the staples. They get a lot of their structure here. When we first started using the staples, I thought that I worried that the corners were high, and I pretty quickly realized compared to a plate, they're super, super low profile, and patients have not complained about it. They're super solid, and they take like, I think my fixation time for a Lapidus is maybe like 5 minutes. It's so easy and fast, and the system really is so intuitive. I think you'll really enjoy it.